Okay,
And while
great.
you're
Yeah.
setting that up, just for the audience watching, I want to cover a couple of topics that he hit on. So, number one, I'm a huge advocate of saying, look, if we don't understand the reimbursement, how can we ever possibly create a plan of care? We have to take into account the financial impact of the prescription we're creating. And so, by doing this, even if the client never became one of our patients, we can at least guide them to the most appropriate resources for them within their financial limitations or restrictions. But what it really does is it opens the door to say, look, if you want to come see me, this is going to be the cost. This part of that cost will be paid for by your out of network coverage, and this will be paid for by you. If you're going to go see somebody who is in your provider network, that's great also. This is going to be the cost for that. And I think one of the biggest challenges that we're seeing as physical therapists in private practice, many of us are contracted with traditional Medicare Part B, but more and more patients are moving to a Medicare Part C, Medicare Advantage plan. They're not even realizing they're coming off a Medicare Part B. And so when they're coming to us for care, they're actually coming with out of network coverage. Many of the Medicare Part C Advantage plans have out of network benefits, especially right now during the public health emergency. And so even if we're not contracted with that individual Medicare Advantage plan, we can still help the patient utilize and access their out of network coverage. Go ahead, sir.
Yeah, no, absolutely. Medicare Advantage works almost like any other private health insurance plan. So absolutely. So I'm going to share my screen here, and I hid this is a real individual's insurance card that I'm using. So I'm hiding their name and date of birth.
Absolutely.
And so this is a view in our practitioner portal, and I'll expand the view in a minute, where you can check coverage immediately. So I'm going to just click the check coverage button. And
I can blur the stuff out that we need to blur.
That'd be great. So if you look at, then let me just make the screen bigger. So the summary message is they've reached their deductible and they're ready to start getting reimbursed at 70%. You can see the details below. The individual deductible is $2,500. It's been completely fulfilled for the year. Family deductible is $5,000, which has been about almost halfway fulfilled. But as long as one of the deductibles is fulfilled, the reimbursement will start. And now, so this individual.
Let me ask you this real quick. So the green font that's there, is that being generated from Reimbursify, or is that something that's coming from the payer itself?
That's the one thing that we generate.
Gotcha.
To summarize, everything else you see below it is coming from the payer.
Awesome. And is that programmatically generated, that green font, or is I can't imagine there's a human that's typing that up.
No. It's programmatically generated. Okay. So, we don't, practitioners shouldn't have to specialize in understanding insurance benefits.
Absolutely.
Right? And so, I've been studying this stuff for years, so I know how the deductibles work, but, there are two different deductibles listed, and some people might assume that both have to be fulfilled, for example. So, which is not the case. So we auto-generate a simple summary line that shows up at the top, just to clarify things. And so one interesting thing is that I'll just navigate over to our dashboard, and this is a demo account, so all of these are not actual names of real people. So if I scroll to, let's say, this claim that was filed on October 27th, Jennifer Doe, you'll see that her reimbursement percentage shows up in the column here, along with an estimated reimbursement for that appointment. That's coming from the benefits check a similar benefits check that we just did.
Okay.
But this column, the one titled reimbursement for this visit, will always show the most up-to-date and accurate information that we have available to us. So approximately 4 to 5 weeks after this claim has been filed, if it's a first-time claim for this patient, for most payers, we'll be able to update this estimate into the actual dollars reimbursed. So this would get then get replaced with a 135 or 140 or whatever it might be.
Right. So you're gathering that information from the pool of data on claims that are being processed through your system?
The up-to-date actual reimbursement is coming directly from that claim adjudication result.
Gotcha.
Right here, what you see here is an estimate based on the coverage check, similar to what we just ran.
Right. Okay. Awesome.
And while we're in here, I'll just round out the demo by showing you that you see that there's a file a claim button at the end here of the rows. Now, back when I was filing claims for people, I didn't want to necessarily have to do it. This is immensely easier. It takes about 30 seconds to file a claim. If I was to hit one of those buttons, it would just pre-fill all of the codes and information, and I would just adjust the date or the codes or the fee if I needed to, and it would be filed. It's also a great way to file. For example, if you file the first claim for people and not every claim, it creates a Reimbursify account for them. It puts you as the practitioner in their Reimbursify profile in the app.
Okay.
And it puts all the codes from the super bill into their appointment for that claim, so that it onboards them to where the next time they have to file a claim, for example, for the second appointment, they just need to clone the previous claim and adjust the date, take a picture of a new super bill and file it.
I see.
It's a
So
super streamlined way to onboard people quickly.
So when we're looking at the options, the levels of service that you had mentioned earlier, option number one is I give the patient the information and they create their own account, they submit their own claim. Option number two is it's done through the provider, and something like this, where me as the provider creates the initial claim, and then either I create claims for each date of service after the initial claim, or I could create the initial claim, and then if the client then takes over, they can create claims for subsequent visits. Or we could do a pure, like I refer to as a white glove service, where we just take care of everything, start to finish. And that might be included in my cash-based rate. That might be an upsell service where I say, do it yourself. It's free. I'll set you up with the account. We do it for you. It's this much per claim. You guys, Reimbursify has their per claim charge, which I think is great because it's not a percentage like most typical billing companies. It's a flat rate. And so I know my cost basis per claim, so that if I want to then upsell the service, upsell the Reimbursify service, I can do that and have my staff generate the claim, charge maybe $10, $15, $20 to submit it from there. Does that sound about right?
That's the levels of service sound perfect.
Yeah.
On the individual claim fee is what is really only for when the patient is filing the claims through the app.
Okay.
So to file claims through the portal, it's really our Practice Pro that gives you unlimited claims for a pretty reasonable monthly price. And so you could still upsell it. However,
Gotcha.
You wouldn't be paying on a per claim basis. It comes to, with our annual plan, it comes to around $80 a month for unlimited coverage checks, like we just did, as well as unlimited claims, whether the practitioner files them or the patient or both.
Okay. And let me ask you, with the coverage check, is that only available to providers with the Pro plan, or is that something that would be accessible to the individual client if they wanted to check their own coverage for whatever reason?
So right now it's a feature for the Pro plan.
Gotcha.
We're internally discussing whether to, or in what fashion to expand that to our, for example, into our Plus plan. But for right now, it's through our Pro plan. And your second question was great, because you think like an out of network practitioner, like I do. So a feature we have coming out soon is a way to invite people to fill out their own benefit form.
Okay.
So you don't have to be on a phone with them getting their date of birth and their ID number, et cetera. You can send invites to prospective or active clients and patients to run their own benefits, and then you'll get the result and they'll get the result.
So I'll tell you what we do.
Yeah.
On my practice website, the first thing that's above the fold when a new visitor comes to my website is a video of me introducing the practice. The second thing, and really the only other thing, is a verify your benefits form. Now it's still manual where the individual has to submit their information to us. Then we run the benefits through a clearinghouse and then we go back to the individual. But if there would be a way to integrate or embed a form or an option like this on the clinician's website, phenomenal. Because I can tell you, I mean, our website gets a fair amount of traffic. We do a lot of stuff, but the absolute number one actual thing that is used on our website is that form to verify coverage. Because I know clients, they don't want to talk to us on the phone. They're hesitant they have no idea what it's going to cost. When you look at the fee schedule for, a typical private practice clinic versus a hospital clinic, now that hospitals are required to publicly post their pricing, the client is seeing $1,500 for a 60-minute physical therapy visit if they go to a hospital-based outpatient clinic as the fee schedule. Of course, nobody's getting paid that, but they don't know. And so giving the client an opportunity like this to virtually anonymously, without having to talk to a human, put their information in on my website. I've never, and I can tell you in 5 years, I've never had a single individual fill out a form like this on my website, not become a patient of mine, whether it be out of network or in network. It is just the absolute number one best lead generation tool we've ever had on our website. So that would be phenomenal.
We are, trust me, we are looking at ways of doing that in a way to deliver that value for our practitioners, while at the same time making sure it doesn't, get out in the wild and get abused, because each of these costs something on the back end.
Sure.
And so we're looking at how to do that exactly. So.
And I think the invite only is a great way to do it. I'm not saying it has to be publicly available, because even for me, none of us are going to get inundated with thousands of requests, So even if one trickles in every couple of days and I could auto forward the specific invitation once I know that this is an actual human who could actually be a patient, totally worth it. Totally worth it. Let me ask you this. If we can kind of go back to one of the questions that comes up in my Facebook group. So what does happen? What is the process, or what do you recommend when somebody does submit an out-of-network claim, the provider or the patient, and either we find out, well, maybe there was supposed to be a pre-authorization that was done, or we find out that there was a glitch in the system, a 0 was entered instead of an O, or something along a 6 instead of a G. Like, how does your system handle that? And then what is the role of the provider in a situation like that?
Sure, that's a great question. So first of all, our system is designed to minimize those types of errors. So because it's a digital entry field, for example, if you're entering a CPT code or an ICD-10 code and you mistake a G for a 6 or an O for a 0, our system won't accept it. So you'll have, it'll validate those codes as you enter them. Let's say it's a date of birth error, right? You're filing the claim for a patient of yours and you think it's January, but you hit February for their date of birth. And then we'll get a rejection and we'll be able to spot that, pretty immediately, because the insurance just will kick that back and we'll be able to fix that, maybe even without contacting you, right? Because, we might, one of the reasons we keep the patients in the loop in our system, whether you file the claim or they do, is so that stuff like this, there's no reason for us to tell you to go ask your patient what their date of birth is, right? We can just go straight to them, get a picture of their card or whatever. So we handle those types of things without practitioner involvement. The other question you had was about pre-authorizations. Sometimes those things, are not information that's not available until you file a claim, or you call and stay on hold for 40 minutes to find out if they need a pre-authorization. So we're looking at ways of operationalizing that. The benefits check, we're looking at expanding the elements that get shown, so that, the entire benefits report that comes back is many pages long. So we're going to be adding a way for you to, let's say you want to dig deeper, you don't just want to know their deductible and their reimbursement rate, but you want to read the entire report, right? There might be, for your specialty, there might be hidden nuggets of information in there that are really relevant to you. So you'll have a way of browsing that entire report, again, so that you don't have to call or get blindsided by a pre-auth or issues like that. But sometimes that happens, and typically a payer would inform you and or the patient directly that this service requires some sort of pre-authorization, right. And then that can be acted on.
That's awesome. I want to be mindful and respectful of your time. So what we'll do is, if you are looking at kind of when you set out on this journey to create this service, to create this business, what was really kind of the motivation behind it? And, what was your vision? Where do you see the business going? Kind of what's been your vision? Simon Sinek always talks about understanding your why. What's the culture behind Reimbursify? Because I think we live in such a connected community. Like, hearing your history, I can tell. I mean, you're just an entrepreneur at heart, just like me. I treat patients because I love treating patients, but I do business because I love doing business. I love creating value. I love solving problems. So I would just love to wrap up with a little bit more information on the real passion behind this project, because I have to imagine you've had some sleepless nights, you've had some frustrations, you've pushed through some obstacles that most other people would have quit a long time ago, especially since you guys are really the main ones in the market for this kind of thing. What keeps you going?
No, thanks for asking that question. I think I come at it from not just a clinical and business sense. My family ran a bunch of small businesses as I was growing up, but also, I love technology. And I, over the last 10 years, have come to really despise it when I'm asked to do something extra or repeat, in a repeat fashion, when there could have been a simple technological solution.
Yes.
There was a time where I had carpal tunnel and I had to wear a wrist brace, and I was working at this hospital on the weekends, and I actually bought the Adobe PDF, like the full version. This was like 15 years ago. And I digitized all the forms that I had to fill out in that job, like one weekend, because I literally couldn't write for a few weeks,
right.
So I could type, but I couldn't write. And so I've just been really, really facile, I guess is the word, with technology and how it can improve our lives, right? If you think about, I'm sure you've had corporate jobs or hospital jobs where, the amount of red tape and frustrating minutia that you're asked to do is really, it makes you wonder, like, what's the point?
Right.
And so, I have a passion about getting people to practice efficiently. There's a little bit of social justice in here, because I don't think anyone should be spending money out of their own pocket for healthcare and not filing claims, right? Because insurance companies don't need higher profits by you not filing claims.
Right, right.
And so the process should be made easier, and it's made difficult on purpose, and that drives me crazy. That in the year almost 2022, you have to fill out a paper form and snail mail it in just to get a few $100s back. My pet insurance for my dog has an app that lets me file claims.
Yeah.
And yet my insurance company refuses to innovate like that. So
wow.
All of those things really, really drive me and help us deliver for practitioners.
Well, that is just amazing. I really do think you have such an incredible product. And in fact, for those of you watching, when I first started researching the product, researching the company, the brand, listening to interviews, I went ahead and registered as an affiliate because I believed and I knew that I was going to be promoting the service, promoting the product. So full disclosure, I am an affiliate. But regardless of whether I ever make any commission or income from the affiliate program, the reality is, like you, I'm obsessed with efficiency. And I think the fact that I still see patients coming into a clinic, filling out paper forms, putting the same information, their name, their date of birth on 5-6 pages of paper drives me insane. My first goal when we started our private practice was I literally have the system to the point where a patient walks in my door, they give me one ink signature on a piece of paper and we get started. They never sit down. They never have to give me anything else. Everything is done for them and done usually before they even walk in the door, because to me, the patient care experience is where we focus our attention, not on the administrative hassles. So thank you so much. Anybody who wants to learn more about Reimbursify, I'm going to post a link down below this video in the description, taking you straight to the website. I've already got a couple tutorials generated that I'll make public later on today after I publish this interview. And my goal for the next week or two is I already created a provider account. I want to create an individual account so that I can show how the system works on both sides, and then start to work with clinicians who have out-of-network claims that they need to get submitted so that we can kind of work through the process as newbies. And, the goal would be, I think that this will be the tool that a lot of therapists, PTs, OTs, and SLPs, especially as they move into private practice, really it's the missing link because they don't have administrative staff. They don't have a team of billers. And even those who are outsourcing some of their billing, I think outsourced billing is a broken model. I think that it incentivizes the wrong stuff. No billing company can afford a new startup private practice and, who's doing 120,000 a year in revenue. It's just not cost effective. And so this would be an app that I would highly recommend. So again, thank you so much for being on here. Please stay on just a minute. I'm going to wrap this up. So guys, if you missed it, Reimbursify, check out the link in the video description down below and keep an eye out for more videos coming your way.